Dr. Carla Samuel Parks, the Christie Clinic, is here for today's MedLive. Good morning. Thanks for being here.
Good morning. Thanks for having me.
What types of burns and who do you see come in with injuries after 4th of July activities?
Usually minor. In my practice, it would be minor burns, the first degree and second degree burns, the burns that look like sunburns, very superficial. The second degree burns that are a little more red, have some blistering, I would typically see in the clinic. More severe burns that are third degree burns that are more deep, that have numbness, those usually go to the emergency room.
And typically are they kids with sparklers, or what are you seeing?
Usually I would see in the office kids with burns where adults have not been careful with what was going on around them, or kids that were playing with fireworks that have caused injury. A lot of the injuries that occur in children 5 years and less, about half of those burns are due to sparklers. Sparklers get very hot, 1200 to 800 degrees Fahrenheit. You have to consider that boiling water is about 212 degrees Fahrenheit, so that's pretty hot. Some burns that occur because of the sparklers have to do with hair not being tied back properly, or loose clothing that's dangling that has become burned.
Interesting. If there is an accident at your home in the backyard, what should you do right away to treat the child?
Right away assess whether or not this needs to go to the emergency room, or whether you can treat it at home. The more severe burns, the third degree burns definitely need to go. If there's inhalation injury, that needs to go to the emergency room. A burn that is around the full arm or the finger, to the emergency room. At home, you see a burn, you can treat it at home. It's small, it's superficial, less than the size of the palm of the hand. Treat that at home. Immediately start applying cool water, not frigid, and no ice. That can cause further tissue damage.
It seems like that's come out just recently. Why no ice?
It causes further tissue damage to tissue that is already injured because of the burn.
Okay. Anything you always worry with kids that they have those lasting scars too, if it is kind of a superficial injury? Anything you can do to minimize the damage on the scarring? Especially a second degree burn where it's superficial but there is some skin damage, don't unroof the blister. Make sure you use soapy water for cleaning. Apply a Telfa bandage, maybe some antibiotic cream, and just kind of let it heal on its own, and definitely look for signs of infection. Okay, great advice. Thank you so much for being here with us. Dr. Carla Samuel Parks with Christie Clinic in the Muhammad office there.